5 legislative days to revise and extend the remarks and include extraneous material in the resolution or under consideration on the resolution.
Without objection.
And I would yield myself such time as I may consume.
Without objection, so ordered.
Madam Speaker, we're here today to pass the Charlie W. Norwood Living Kidney Donation Clarification Act. And like many of my colleagues, I was pleased when this bill finally first passed the House in March. And I'm happy to report now that we have an agreement with both chambers of a provision that can pass and be signed by the President into law. We suffered all a great loss with Dr. Norwood's loss, and we know he was a recipient of a lung transplant himself and was a committed champion of these causes while serving in Congress. So in addition to helping thousands of Americans today in a way to enhance the prospects of living donations, this bill will be a fitting tribute to Dr. Norwood and his efforts. I also want to thank the Energy and Commerce Committee staff who've worked diligently on this for months. Jessica McNeese, Pete Goodlow, Catherine Martin, and Ryan Long. They've done a great job getting this bill in a condition where it can be signed into law. As many of my colleagues know, this legislation will clarify the procedure commonly known as paired organ donation to make clear that it is legal, and in doing so will provide hope to thousands of Americans who now are waiting for transplants, particularly kidney transplants across the United States. Paired organ donation will make it possible for thousands of people who wish to donate a kidney to a spouse, a family member, or a friend but find that they're not medically compatible, but still allow them to become living kidney donors. As of this afternoon, there are fully 97,000 candidates for organ donations waiting on the national waiting list, but there are only 28,931 transplants performed, all in the total of 2006, and only 6,730 were from living donors. Clearly, we've got work to do. This resolution will take a significant step towards reducing the number of patients on the waiting list and give much more hope for others to hope that and know that their wait will not be endless. It's imperative we make absolutely clear that there's no intent by Congress to bar this procedure. Simply put, we want this legislation to save lives immediately, and it will do so when enacted. I also want to take a moment to salute and thank Dr. Connie Davis, who's a constituent and a friend and a very knowledgeable transplant physician from the University of Washington, Seattle. In addition to her years of caring for local transplant donors and recipients, she's advised me and others on transplant issues as chairwoman of the American Society of Transplantation. It's the largest organization in the world representing professionals engaged in the field of solid organ transplantation, and her help has been invaluable in putting this legislation together and make sure that those 90,000 patients get access. So for those thousands of patients waiting today who spend costly and often arduous time on dialysis treatment, their time on the waiting list can be significantly shortened with passage of this bill. And I want to thank my colleagues across the aisle who worked on this, Nathan Deal and others. And with that, Madam Speaker, I will reserve the balance of my time.
Gentleman reserves. Gentleman from Georgia.
Madam Speaker, I yield myself such time as I may consume.
Without objection.
Madam Speaker, I rise today in strong support of this legislation, which was originally introduced by my dear friend, the late Congressman Charlie Norwood, and has now been renamed the Charlie W. Norwood Living Organ Donation Act. As a lung transplant recipient, Charlie believed in organ donation. This good piece of legislation will help facilitate life-giving organ donation by clarifying the intent of the National Organ Transplant Act to protect the common sense practice of paired organ donation. A paired donation occurs when a donor who is willing to give an organ to a family member or a friend but is biologically incompatible donates to another patient who also has an incompatible donor. By cross-matching two or more incompatible donor-recipient pairs, more patients can receive organs and more donors can give them. The changes we're making this afternoon help conform the bill to an amendment that was offered in the Senate during consideration. The amendment helps to ensure this bill can adapt to advances in science should organs other than kidneys be eligible for paired donation. As we pass this bill today and later send it to the President for his signature, we honor a great member of this House and carry forward some of his goals. I would like to thank Mr. Inslee for his leadership on this issue, and I would urge my colleagues to join me in support of this legislation. I would reserve the balance of my time.
Gentleman reserves. Gentleman from Washington.
I'll yield the balance of my time, Madam Speaker.
Gentleman yields the balance of his time.
Madam Speaker, I would like to yield such time as he may consume to another colleague of the Georgia delegation, Dr. Phil Gingrey.
Gentleman from Georgia.
Madam Speaker, I thank the gentleman for yielding. I thank the gentleman from Washington, our friend, Representative Inslee, and, of course, Representative Nathan Deal. I am proud to be here to support this resolution, H.R. 710, in honor of our colleague, the late Dr. Norwood. Representative Inslee described the magnitude of the issue. I wasn't even aware that there were, as a physician, maybe I should be, but over 90,000 people who are on a waiting list, and a fourth of them each year get transplants, and only a very small number get a transplant from a living donor, as Representative Inslee pointed out. And, of course, Representative Deal just explained to us exactly what this cross-living donor program, how it would work. So it is an easy bill, Madam Speaker, to support for our late and dear friend and colleague, Dr. Charlie Norwood. Earlier this year, we passed a bill honoring Dr. Norwood by naming a VA medical center in Augusta, Georgia, the heart of his congressional district, in honor of the great work that he did on behalf of our veterans. I think my colleagues, Madam Speaker, know that Charlie Norwood served as a dental officer in Vietnam, in combat, got 2 Bronze Stars, I think a medical combat award. He was a great spokesperson on behalf of our veterans, but also in regard to health care. Before I was even thinking about running for this great office that I hold now, Madam Speaker, Charlie Norwood had that patient Bill of Rights. I think a lot of my colleagues would remember that, Madam Speaker. You indeed probably were here at that time. And so this is just another opportunity for us not just to honor Dr. Norwood, but to realize that he worked so diligently on behalf of veterans issues and health care issues. So it's a great honor to be here today. And I'll tell you, on a personal note, my colleagues, Madam Speaker, I have a senior legislative assistant, Josh Waller, whose dad, Jerry, last year died while on a waiting list for a liver transplant. That was awfully painful for me to watch that happen to the dad of one of my great staff members. So this is a wonderful opportunity for us to do something really good for these people that Representative Deal, Representative Inslee described, that on these waiting lists that suffer dialysis. And as Representative Deal pointed out, the Senate amendment just changed it a little bit so that other organs other than kidneys, indeed, Dr. Norwood himself, as Representative Inslee pointed out, was the recipient of a lung transplant. Unfortunately, did not work for him. But God bless him, and I'm proud to be here today to support this bill. I urge all of my colleagues to do the same, and I yield back.
Gentleman yields back.
Speaker, I urge the unanimous adoption of this bill, and with that I would yield back the balance of my time.
All time having been yielded back, the question is, will the House suspend the rules and agree to House Resolution 837? Those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended, the resolution is agreed to, and without objection, the motion to reconsider is laid on the table.
Madam Speaker, on that I would demand the yeas and nays.
The yeas and nays are requested. All those in favor of taking this vote by the yeas and nays will rise and remain standing until counted.
Yeah, I've been counted.
A sufficient number having arisen, The yeas and nays are ordered pursuant to Clause 8 of Rule 20, and the Chair's prior announcement. Further proceedings on this motion will be suspended, will be postponed. Without objection, the title of H.R. 4118 is amended. Pursuant to Clause 12A of Rule 1, the House will stand in recess